Fibroids are nothing to ignore. Today, Dr. Holly Miller will tell us all about new technology for fibroids in Tackle the Fibroid, Protect the Uterus.
Welcome to Top Docs. I'm Maggie McKay.
Dr. Miller, thank you so much for being here today. I have a lot of questions, but first, can you please introduce yourself?
Hi, Maggie. Thank you for having me today. I am Dr. Holly Miller, a board-certified obstetrician gynecologist, and I practice in the beautiful town of Naples, Florida.
Oh, beautiful. That's where my brother lives. It is beautiful. To begin, what are fibroids?
Fibroids are benign tumors of the uterus. They are extremely common, affecting 50 to 60% of women, but a little bit more common in women of African American descent. They can be discovered at any age, but the older we get, the more common they are.
And what are some of the symptoms of uterine fibroids?
Fibroids can be small and relatively asymptomatic. Depending on where they're located, even the small ones can cause symptoms such as heavy menstrual bleeding or pelvic pain, increased pain associated with menstrual periods. They can affect the bladder, causing urinary frequency, or affect the bowel, causing constipation. If they're large enough, they may be felt during sexual intercourse or may cause problems with infertility. So there is a wide range of symptoms that can affect women of all ages.
And Dr. Miller, is there a way to protect the uterus and still treat fibroids?
Absolutely. There are so many treatment options available, and new ones have come online very recently, and that's what I'm excited to share today.
Can you tell us about the Acessa procedure to start with?
Absolutely. This is one of the ones that I am most excited about. Acessa is a laparoscopic radiofrequency ablation of uterine fibroids. Now, that's a lot of big words. Acessa has been available for more than 10 years, but not widely available. It's really only been in the past 2 years that we've been able to match the technology with insurance coverage. And so I've been able to offer this procedure here in Southwest Florida for over a year. It is much different than our prior surgical options in that I go in laparoscopically, so just 2 small incisions in the abdomen. I place an ultrasound into the abdomen through one of those incisions. With that ultrasound active, I actively find all of the fibroids that are in that woman's uterus. Each fibroid is then targeted with a thin needle and heated to over 100 degrees Celsius. And so that's the radiofrequency part of it. Acessa works by shrinking the fibroids. So each fibroid is treated individually. Over the course of a few months to follow the surgery, the fibroids shrink by about 50 to 60%, significantly improving my patient's symptoms.
That is amazing when you look back just a few years ago. What about the MyoSure myomectomy?
Right. So there's, fibroids come in a variety of different locations. And so we use these different technologies and different modalities based on where the fibroids are located. So for fibroids that are mainly on the inside of the uterus, really affecting that part of the uterus that we need for pregnancy, and the fibroids that are going to cause the most heavy menstrual bleeding, we can target those with an outpatient hysteroscopic approach. Hysteroscopy means placing a very small telescope directly into the uterus. This is a surgical procedure that I do in the comfort of my office, so my patients are awake, and the surgery takes 10 to 15 minutes. So I place a small camera into the uterus. I can visualize the fibroids that are there within the cavity of the uterus, and then shave out that fibroid through a directed visualization and using a device, specifically the MyoSure device. So that's the name of the technology that I use. And it is a full tissue removal device. So it shaves the tissue, completely capturing all of that pathology so that we know that everything that I take out goes directly to the pathologist to be evaluated.
And what are some of the other treatment options? Because there are a few.
There are. So, we talked very briefly here about MyoSure, which is a hysteroscopic myomectomy. In our more traditional approaches for fibroids, which have been available for many years, most women would be presented with options of an abdominal or laparoscopic myomectomy. A myomectomy is a much more involved surgery than what I described with Acessa. To do a myomectomy, the uterus has to have an incision made on it. The fibroid is then shelled out, sort of opening the fibroid or opening the uterus, making a small incision on that uterus, removing as many of the fibroids as are present, and then closing the uterus with multiple layers of suture. While myomectomy has been available for many years, the recovery is much longer than with our new Acessa procedure. Of course, there are medications available that can temporarily shrink fibroids. For some women, this is an appropriate choice prior to surgery or if they're not a surgical candidate. And there are other women that would consider a full uterine artery embolization where they would treat the entire uterus. But in my practice, I prefer to target the problem directly by targeting the fibroids themselves with a directed myomectomy or Acessa technology.
And not to overshare, Dr. Miller, but I will say years ago, I had a 5-pound fibroid, which is pretty big, I think. And I didn't even know it until I went in for my annual checkup. So I'm only telling you this because I'm thinking today's treatments and recovery have to be easier than it was then because my doctor said, it's going to be a harder recovery than a C-section. It's going to take about 6 months. And it did. And I was young. So how is recovery now? And how does someone even know if they have fibroids and whether or not they need treatment?
Well, Maggie, thank you for sharing that. That takes a lot of bravery to share that in this very public setting. But what a reminder that we sometimes don't even know what is happening inside of our body. 5 pounds is quite large. And I bet there was a concern that it was a cancer. And I'm thrilled that you had such great outcomes. With our newer surgical treatments, we're able to get our patients back to work, back to life, back to all their normal activities fairly quickly. My patients that are choosing Acessa technology are choosing it because I let them return to almost all of their activities within 5 days of surgery. Wow. That is amazing.
It is.
Most women that I take care of say things like, Dr. Miller, I have children and a significant other and an important job, and I don't have time for an involved surgery. And so Acessa is a great option to improve their symptoms, but still get them back to their normal lives as quickly as possible.
And are there any risks to surgery?
Well, there's always risks to surgery, and we never undergo surgery lightly. I like to tell all of my patients that risks can be anything from bleeding to developing an infection. If we're doing it laparoscopically, the intestines and the bladder sit right around the uterus, so there's always risk of damaging those. And, risks are small with surgery, but they're never zero. And so we have to choose appropriate patients and use appropriate caution. And encouraging, women to choose a skilled surgeon is all important to maximize that recovery.
What are the chances that fibroids will return after treatment? I know they used to say 50%, which I thought was pretty high. Is that still the case?
I think 50% is pretty high. We have to consider what surgical treatment that we're doing. In the case of a myomectomy, the goal is for the surgeon to physically remove all of the fibroids that are present. With Acessa, I am doing live action ultrasound in the operating room, so I should be treating every fibroid that is already present in that uterus. But for a woman that is predisposed to growing fibroids, she can always grow them again in the future. So I probably would quote that number a little bit lower, maybe at 20%, but percentages are relative. It depends on a woman's age, and it depends on so many different factors.
Is there any way to prevent getting them?
That we know of, there is no way to prevent uterine fibroids. There is a slight genetic predisposition to getting them, so they may be seen if your mother had them, then you might be at an increased chance of getting them. But overall, we don't really understand why some women develop these and other women don't. But remember, I've already said 50% of women are going to have fibroids at some point in their lives. So it's important to be aware that most of us are at risk, and we need to let our gynecologist or our doctor know of any symptoms so that an ultrasound can be done and appropriate treatment discussed while they're still small. We sure don't want to wait until they're 5 pounds.
Yeah, you're not kidding. And go for those yearly checkups because, I had no idea. And if I hadn't done that, it could have gone south fast. Dr. Miller, will fibroids affect childbearing and pregnancy?
Yes, infertility is a huge risk factor with fibroids. That really depends on the location of the fibroids. If the fibroid is within the cavity or within the inside of the uterus, it can affect the ability to get pregnant, increasing the chance of just infertility completely or an early miscarriage. Larger fibroids that are in the wall or the body of the uterus can grow significantly during pregnancy and may cause things such as preterm labor or preterm delivery. Sometimes they're large but very low in the uterus, and in that case, they might block the safe passage of the baby for a vaginal delivery, increasing the chance of a C-section. So I've seen numerous complications from the presence of fibroids in my patients.
Is it common to find endometriosis in the uterus while you're doing surgery for fibroids?
There isn't a specific known link between fibroids and endometriosis. However, whenever we're doing a laparoscopy or any type of a gynecological surgery, I'm always looking for evidence of endometriosis. Endo is a disease that also causes similar symptoms, such as pelvic pain. Many women have no idea that they have it. And when I'm doing a laparoscopic surgery, I can safely remove all evidence of that endometriosis at the same time. So we started the surgery for fibroids and ended up treating 2 different things, contributing to my patient's pelvic pain and other symptoms, and hopefully improving her overall health and life for many years.
Mm-hmm. Well, this has been so fascinating and informative and helpful, especially comparing it to a number of years ago and how far treatment options have come. This is so great to hear. Is there any takeaway you'd like listeners to know before we wrap it up?
I think it's important for women to know that there are new and different surgical techniques. And if they have fibroids, they need to be specifically asking their doctor what treatment option they will perform. Myomectomy is not the same for each of us as surgeons. And again, Acessa is new. There is still a limited number of gynecologists across the country offering it. It is exciting. It is transformative. And I am so excited to have been able to bring it here to Southwest Florida in the past year. For anyone listening that's outside of the Southwest Florida area, there are Acessa surgeons across the country. And I know that my colleagues would be happy to speak with women about how we can help them.
Dr. Miller, it's been a pleasure talking with you and learning all about fibroids. Thank you for joining us today and sharing your knowledge and your expertise. If someone would like to make an appointment with you or just find out more, where would they go?
Absolutely. It's been great to be here today. My website is AWP Naples. That stands for A Woman's Place, awpnaples.com. On the website, you can find all of my contact information and also videos about Acessa and MyoSure.
Thank you so much. If you found this podcast helpful, please share it on your social channels and check our entire library of podcasts for topics of interest to you. This is Top Docs Podcast. I'm Maggie McKay. Thank you so much for joining us, and be well.